Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, we're continuing our review. Today we complete section 1 of the 2025 official coding guidelines. Answer a major question that I keep getting. Where do the 2025 guidelines start and the 2024 end? Well, when I change from 2024 to 2025, all of the videos that I had in 2024 apply to the 2025. So as long as you're studying this whole series that I'm doing, you're meeting the guidelines for 2025. Okay, just want to make that clear. All right, let's try to finish up section 1 today. And let's see where we are. We are down to number 16, Z codes that may only be principal or first listed diagnoses. Okay, first let's refer to the guidelines. 16. The following Z code categories may only be reported as the principal or first listed diagnoses except when there are multiple encounters on the same day and the medical records for the encounters are combined. And those Z codes are Z00, encounter for general examination without complaint, suspected or reported diagnoses, except Z00.6. Z00.1, encounter for other special examination without complaint, suspected or reported diagnoses. Z02, encounter for administrative examination. Z04, encounter for examination and observation for other reasons. Z33.2, encounter for elective termination of pregnancy. Z3181, encounter for male factor infertility in female patient. Z31.83, encounter for assisted reproductive facility procedure cycle. Z31.84, encounter for fertility preservation procedure. Z34, encounter for supervision of normal pregnancy. Z39, encounter for maternal postpartum care and examination. Z38, and it's interesting they put 39 before 38, live-born infant according to place of birth and type of delivery. Z40, encounter for prophylactic surgery. Z42, encounter for plastic and reconstructive surgery following medical procedure or healed injury. Z51, sorry about that. Z51.0, encounter for anti-neoplastic radiation therapy. Z51.1, encounter for anti-neoplastic chemotherapy and immunotherapy. Z52, donor of organs and tissues, except Z52.9, donor of unspecified organ or tissue, which makes sense why that couldn't be primary or principal. Z76.1, encounter for health supervision and care of fondling. Z76.2, encounter for health supervision and care for other healthy infant and child. And Z99.12, encounter for respiratory or ventilator dependence during power failure. Going back to my outline, I do have a Codemaster Coach note. And y'all, my note just says, I remind my students to just spend time in their code books. I like for them to just look through the book, spend time in the book, get to know your book. Remember I said know your book so well that you kind of have an idea what the codes start with. So when you see that beginning alphabet, whether it's E, you know it's either hypothyroidism or type 2 diabetes or type 1 diabetes or some kind of hormone deficiency. I realize while under productivity standards, while on the job, that most of my coders, my students use encoders. However, for training and learning experiences, being able to highlight, to spot, and even to practice, I recommend the physical book. Let me share with you what I mean. I took screenshots and I went to the Z codes, and notice on this, I just took a picture of the Z code starting at Z00, And look, there's the official guidelines, routine and administrative examination. It quotes the guideline and says Z codes that may only be principal or first listed diagnoses. So it's telling you that Z00 code can only be the first listed or principal diagnoses. Your book is telling you this. Remember, your book goes with you into the exam. So if you spend enough time in your books, you'll see all of these notes that let you know rules that you need to remember. And I know we're in the Z code, so I went on a little further and I looked at Z37, outcome of delivery. This category is intended for use as an additional, not first listed, but as an additional code to identify the outcome of delivery on the mother's record. It is not for use on the newborn record. It reminds you of this. You come down here to Z38. It identifies the guideline. It says principal diagnoses for the birth record, Z38. That means the first listed. Your book is telling you this. This category is for use as the principal code on the initial record of a newborn baby. It is to be used for the initial birth record only. It is not to be used on the mother's record. Go through and highlight these things in your book. Look at Z39. Z codes that may only be principal or first listed diagnoses. Again, it's letting you know this has the Z39 has to be the first listed. And coming down here to Z40, Z codes that may only be principal or first listed diagnoses. It's telling you that in your book. So make sure you're following and studying along in your book and highlighting. These are your books, write in them. All right, we're down to 17 social determinants of health. And I said refer to the guidelines. So let's look at the guidelines for 17. It just says social determinants of health. They call it SDOH. Codes describing social problems, conditions, or risk factors that influence a patient's health should be assigned when this information is documented in the patient's medical record. Assign as many SDOH codes as are necessary to describe all of the social problems, conditions, or risk factors documented during the current episode of care. For example, a patient who lives alone may suffer an acute injury temporarily impacting their ability to perform routine activities of daily living. When documented as such, this would support assignment of code Z60.2, problems related to living alone. However, merely living alone without documentation of a risk or unmet need for assistance at home would not support assignment of code Z60.2. Documentation by a clinician or patient-reported information that is signed off by a clinician that the patient expressed concerns with access and availability of food would support assignment of code Z59.41, food insecurity. Similarly, medical record documentation indicating the patient is homeless would support assignment of a code from subcategory Z59.0, homelessness. So you see where this SDOH information is going? It says for social determinants of health classified to Chapter 21, such as information found in categories Z55 through Z65, persons with potential health hazards related to social, economic, and psychosocial circumstances, code assignment may be based on medical record documentation from clinicians involved in the care of the patient who are not the patient's provider, since this information represents social information rather than medical diagnoses. For example, coding professionals may utilize documentation of social information from social workers, community health workers, case managers, or nurses if their documentation is included in the official medical record. Patient self-reported documentation may be used to assign codes for social determinants of health as long as the patient self-reported information is signed off by and incorporated into the medical record by either a clinician or provider. Social determinants of health codes are located primarily in these Z code categories. And we have Z55, problems related to education and literacy. Z56, problems related to employment and unemployment. Z57, occupational exposure to risk factors. Z58, problems related to physical environment. Z59, problems related to housing and economic circumstances. Z60, problems related to social environment. Z62, problems related to upbringing. Z63, other problems related to primary support group, including family circumstances. Z64, problems related to certain psychosocial circumstances. Z65, problems related to other psychosocial circumstances. So as you can see, these SDOH, social determinants of health, can affect a lot of things. And I've got a Codemaster Coach note here in purple on my outline. How vital is information other clinicians know to the patient's diagnoses? If the patient was homeless, would that matter? And I think about elderly patients coming into the emergency room at 11, 12, 1 o'clock at night. And due to an acute condition, there's a hesitancy about sending them home. Wouldn't it be vital to know that these patients are homeless and maybe we can keep them in the ER or in an observation status overnight? If a patient has financial issues, would that matter? When the physician goes to prescribe medications, making sure to prescribe generic over name brand or thinking about the prices involved. If a patient's living arrangements could affect the patient, would that matter? These are areas that need to be documented by the attending physician so that they can be documented and coded. Because remember, without that physician documentation, we can't code it. All right, we're down to chapter 22, codes for special purposes. So let's refer to the guidelines on those. 22 says here, U07.0, vaping related disorders. Guys, we're seeing a whole lot of that now because of the new vapes. We're seeing even our teens. I've got a little boy that's in elementary school, and he always says, Mom, I go into bathrooms and the vent, people who are vaping, the vents evidently aren't working because the bathrooms are vaped. You walk in, you're walking into clouds of smoke in elementary. Okay, something's wrong in elementary school. Look at U07.1, COVID. Remember, before April 1st of 2020, we didn't have a COVID code. We've got a COVID-19 code. And U09.9 is post-COVID conditions, unspecified, because we're hearing a whole lot about long-term COVID or COVID period. So I think even today in 2025, we're experiencing a lot of conditions due to COVID. All right, let me look back on my handout, make sure I covered everything. Yes, okay, we're ready for my next video, which is on selection of the principal diagnoses. So get ready, because next week I really want to do an in-depth study or discussion when it comes to section 2. And we're going to be talking about the selection of the principal diagnoses, because remember, when it comes to government regulated third-party payers, this principal diagnoses, well, and to all really, that principal diagnosis determines your reimbursement rates. So you got to get that principal diagnoses right. Okay? All right, guys, that's it. I'll see you next week with the next video, section 2 of the 2025 official coding guidelines. Thanks, guys. I'll see you in the next one.